Did you know that blood clots are a silent killer? That's right, these seemingly innocuous formations in our blood vessels can often spell danger, quietly working their mischief without us even realizing it. So what exactly is a blood clot? In simple terms, it's a clump of blood that is transformed from a liquid to a semi-solid state. This process is crucial for preventing excessive bleeding when you're injured. However, when clots form inside your veins without a clear reason or fail to dissolve naturally, they can lead to serious health issues, including heart attacks and strokes. This is why they've earned the ominous title of a silent killer. Understanding blood clots, their causes, risks, and ways to prevent them is essential for our health and well-being. So, let's begin our journey to understanding this silent killer. Stay tuned as we unravel the mysteries of blood clots, their silent dangers, and the ways we can keep them at bay. Blood clots can form in various parts of our body, each having its unique implications. Let's explore some common types. First, we have deep vein thrombosis, or DVT, which occurs in the deep veins of your body, often in the leg. If a part of this clot breaks off, it can travel to the lungs, leading to a pulmonary embolism, a potentially life-threatening situation. Next, there's the cerebral venous sinus thrombosis, a rare type of stroke resulting from a clot in the brain's venous sinuses. This type can cause headaches, blurred vision, and other neurological symptoms. Then, we have arterial clots. These clots form in the arteries and can cause conditions like heart attack and stroke. Lastly, there's coronary thrombosis, a clot that forms in the heart's blood vessels, potentially leading to severe heart damage. Knowing the type of clot is crucial in determining the course of treatment. What causes blood clots, and who is at risk? Let's bring this into focus. Blood clots can form when blood thickens and clumps together. This can happen due to a variety of reasons, ranging from lifestyle factors to medical conditions and genetic predispositions. Starting with lifestyle factors, lack of physical activity is a common cause. When you're stationary for long periods, the blood flow in your legs slows down, increasing the risk of clot formation. This is why long flights or bed rest after surgery can be problematic. Next, let's talk about some medical conditions that can increase the risk. Heart arrhythmias, or irregular heartbeats, can cause blood to pool in the heart and form clots. Additionally, certain types of cancer, as well as treatments like chemotherapy, can increase blood clot risk, as can kidney disorders and inflammatory conditions like lupus. Smoking is another significant risk factor. It damages the lining of blood vessels, making clots more likely. Meanwhile, obesity puts extra pressure on the veins in your pelvis and legs, leading to an increased risk of deep vein thrombosis, a type of blood clot. Pregnancy also poses a risk due to increased pressure on the veins in the pelvis and legs. And women who take hormone-based medicines like birth control pills or hormone replacement therapy are at higher risk. Now onto genetic predispositions. Some people have inherited disorders that make their blood clot more easily. If a family member has had a blood clot, your risk might be higher. Age is another factor to consider. While blood clots can happen at any age, they become more common as you get older, particularly over the age of 60. Lastly, having had a blood clot before increases the likelihood of having another. It's crucial to be aware of these risk factors and discuss them with your healthcare provider, especially if you have multiple risk factors or a family history of blood clots. Understanding these risk factors can help in prevention and early detection. So remember, knowledge is power when it comes to managing your health. Blood clots can silently cause major health problems, if not fatal conditions. Picture this, a small unnoticed clot forming in the deep veins of your body. It's quiet, it's unassuming, but it's there, potentially lurking with devastating consequences. Blood clots, if left untreated, can become a silent but deadly danger. They can travel through our veins, making their way towards vital organs. If a clot lodges in the lungs, it causes a pulmonary embolism, a condition that can prove fatal if not promptly treated. The symptoms, such as shortness of breath or chest pain, are often mistaken for less serious conditions, adding to their silent, deceptive nature. Similarly, if a blood clot finds its way to the heart, it can lead to a heart attack. The heart is a muscular organ that relies on a constant supply of oxygen-rich blood. A clot can block this supply, causing parts of the heart muscle to die. This silent attack can be sudden and severe, sometimes with no warning at all. But the silent dangers don't stop there. A clot can also journey to the brain, leading to a stroke. This happens when the blood supply to part of your brain is cut off, causing brain cells to die. The consequences can be severe, leading to permanent disability or even death. And let's not forget about organ damage. If a clot blocks blood flow to other parts of the body, such as the kidneys or the liver, it can lead to long-term damage. This may not be immediately life-threatening, but it can drastically reduce a person's quality of life. These potential complications are not always visible, not always noticeable. They can occur without major symptoms, making them silent but potentially deadly. The quiet nature of these dangers often means they are overlooked until it's too late. This is why awareness, early detection, and prompt treatment are absolutely crucial when it comes to blood clots. These silent dangers highlight the importance of awareness and timely intervention, because when it comes to blood clots, silence isn't just golden, it can be deadly. How do we detect these silent killers? That's the million-dollar question. Detecting and diagnosing blood clots is a pivotal step towards successful treatment and management. Typically, doctors will begin with a physical examination and a thorough review of your medical history. If a blood clot is suspected, they may proceed with a variety of diagnostic tests. The choice of test often depends on the location of the suspected clot. For instance, for blood clots in the legs or arms, a simple non-invasive test called a Doppler ultrasound might be used. This test utilizes sound waves to create a picture of the blood flow in your arteries and veins. It can reveal the presence of a clot and even provide information about its size and location. In other cases, especially when a clot is suspected in the lungs or the brain, a computerized tomography or CT scan may be more appropriate. This imaging method takes multiple X-ray images from different angles, providing a cross-sectional view of the body. It can help identify blood clots in the lungs, known as pulmonary embolisms, or in the brain, which can lead to strokes. For deep-seated clots that are harder to reach, doctors might opt for a venography. This involves injecting a dye into a vein, typically in your foot or ankle, and then taking X-ray images. The dye illuminates the blood flow, highlighting any blockages caused by clots. In some cases, blood tests may also be useful. For example, a D-dimer test measures a substance that's released when a clot breaks down. Elevated levels of D-dimer can suggest the presence of a clot. However, it's important to remember that these tests are not infallible. They can sometimes yield false positives or negatives. Therefore, a combination of tests is often used to confirm a diagnosis. In the end, the key to successful detection and diagnosis lies in the hands of medical professionals who are trained to interpret these tests accurately. And remember, if you're experiencing symptoms that could indicate a blood clot, don't hesitate to seek medical attention. Early detection can significantly improve the prognosis of blood clot conditions. Once detected, how do we treat and manage blood clots? That's a question we often hear. The answer lies in a multifaceted approach that includes medication, surgery, and lifestyle modifications. Let's start with medications. Doctors often prescribe anticoagulants, also known as blood thinners, to prevent clots from forming. There are several types, including warfarin and newer drugs like dabigatran. They work by slowing the body's clotting process, giving your body time to break down the clot naturally. However, these medications require regular monitoring to ensure the correct dosage. Now let's move to thrombolytics, often referred to as clot busters. These drugs are used in emergency situations to rapidly dissolve large, life-threatening clots. But they come with a risk of serious bleeding, so they're used sparingly. In some cases, doctors may recommend surgery or minimally invasive procedures. For instance, a surgeon might insert a filter into the body's main vein to prevent clots from traveling to the lungs. Or they might perform a thrombectomy to physically remove a clot. But treatment isn't just about medication and procedures. Lifestyle changes play a crucial role in managing and preventing blood clots. Regular exercise helps improve circulation, while a healthy diet can reduce the risk of clot formation. It's also crucial to quit smoking, as it can damage blood vessels and increase clot risk. For those with a high risk of developing clots, compression stockings might be recommended. These can help prevent clots in the legs by applying pressure to improve blood flow. Lastly, let's not forget the importance of follow-up care. Regular checkups allow doctors to monitor progress and adjust treatment as necessary. Patients may also need help managing the emotional impact of a blood clot diagnosis, so mental health support can be an essential part of the management plan. And remember, each person's treatment plan will be unique, tailored to their specific needs and medical history. The goal is always the same: to dissolve existing clots, prevent new ones from forming, and reduce the risk of complications. Effective treatment and management can help prevent complications and improve quality of life. This is the crux of our mission when dealing with blood clots. Prevention is better than cure, isn't it? This age-old adage holds true, especially when it comes to blood clots. Let's talk about some of the key strategies that can help prevent blood clot formation. Regular exercise plays a crucial role in blood clot prevention. It gets the blood flowing, reduces inflammation, and can help maintain a healthy weight. Whether it's a brisk walk, a swim, or a bike ride, any form of aerobic exercise can be beneficial. Remember, the goal is to keep moving and keep that blood circulating. Another important prevention strategy revolves around diet. Eating a balanced, healthy diet not only aids in maintaining a healthy weight but also impacts blood clotting. Foods rich in omega-3 fatty acids like fish, walnuts, and chia seeds are known to reduce blood clotting. Conversely, it's best to limit intake of foods high in vitamin K, like spinach and kale, if you're on blood-thinning medication, as they can counteract the medicine's effects. Hydration also plays a vital role. Dehydration can lead to thicker blood, increasing the risk of clots. So make sure you're drinking enough water, especially when exercising or traveling. For individuals at high risk of developing blood clots, medication may be necessary. Anticoagulants, or blood thinners, can help prevent clots by reducing the blood's ability to clot. However, these should always be taken under the supervision of a healthcare provider, as they can also increase the risk of bleeding. In addition to these lifestyle changes and medications, regular checkups are essential. Regular screenings can help detect any potential issues early, making them easier to manage. And let's not forget the importance of awareness. Understanding the signs and symptoms of blood clots can lead to early detection and treatment, potentially saving lives. These prevention strategies can go a long way in reducing the risk of blood clots. With a proactive approach, we can safeguard ourselves against this silent killer and lead healthier, safer lives. The fight against blood clots is ongoing. What does the future hold? As we stand at the precipice of tomorrow, we see a future brimming with potential advancements in the prevention, detection, and treatment of blood clots. In the realm of prevention, there's a burgeoning focus on personalized medicine. This approach is based on the understanding that each individual has unique genetic, environmental, and lifestyle factors that influence their health. By tailoring preventive measures to these individual factors, we can offer more precise and effective protection against blood clots. For detection, the future is looking increasingly digital. The advent of wearable technology, for instance, offers exciting possibilities. Imagine a world where your watch could alert you to a potential blood clot before you even feel the first symptom. That's the power of real-time health monitoring, and it's closer than you might think. As for treatment, the focus is on developing safer and more effective anticoagulants. Current medications are not without their risks and side effects, but new research is leading us towards breakthroughs in natural blood thinners and more targeted anticoagulant therapies. These could minimize side effects while maximizing efficacy, a win-win situation for patients and doctors alike. Furthermore, interventional radiology is on the rise. This medical specialty uses minimally invasive image-guided procedures to diagnose and treat diseases in nearly every organ system, including blood clots. As this field advances, it promises less invasive and more effective treatments. But perhaps the most exciting future direction lies in the integration of all these advancements. The convergence of personalized medicine, digital health monitoring, safer anticoagulants, And interventional radiology could revolutionize how we tackle blood clots. And let's not forget the power of education. As we continue to unravel the mysteries of blood clotting, we can better inform the public about risks, symptoms, and preventive measures. Knowledge is, after all, our best defense. As we continue to learn more about blood clots, we move closer to winning the fight against this silent killer. The future is indeed promising, and with each step forward, we edge closer to a world free from the threat of blood clots. We've learned a lot about blood clots today. From their formation to their prevention, we've uncovered the types of blood clots, from those lurking in the veins to those that form in the arteries. We've explored the factors that can put us at risk and the silent dangers these clots pose. We've delved into how these silent killers are detected and diagnosed, and the various treatments available to manage them. We've also highlighted the importance of prevention and strategies to keep blood clots at bay, but that's not all. We've also looked to the future, where research and medicine promise new ways to combat blood clots. From breakthroughs in natural blood thinners to personalized medicine, the future holds great potential. Remember, knowledge is power. Let's use this knowledge to prevent and fight against this silent killer.